It's August.
Hi, nice to
Hello.
see you.
Beautiful hot weather.
Yeah, you look like you have a great dress on.
I bought this in Spain. It's a wonderful, all the clothes there are great. The only thing is they're all hot weather clothes. So I would love to buy my whole wardrobe there if I could, but everything is scorching hot all the time. So everything I bought there is for a hot day. It's like, and I'm going to the beach after
Per
this. So
Perfect for right now.
perfect for
So,
now. Yes.
perfect for now. Why don't we begin today with sort of, I thought it would be, we could open with something a little more lighthearted. But remember when you were here the other day and I opened the drawer in my kitchen and you were like,
Your-
why do you have 50 corks in there?
And then you showed me your true stash of corks where
My
you
cork
have
collection.
hundreds of them. Yes, I had no idea.
So
I knew you liked wine, but I didn't know you liked corks. Okay.
Well, so anyway, we thought it was kind of a funny moment. You're like, oh my gosh, I just, learned something really quirky, or as some say, quirky about you. So
Corky.
yeah,
Yeah.
quirky, quirky, quirky. So we asked the community what their little quirks are, and we got a few responses, not as many as I thought we would. But I thought it'd be kind of funny to share
Okay.
them.
All right.
So let me find them. Maybe people are a little more secretive about their quirks. Um, One says, I like to do household chores naked when I'm alone. Oh, I've done
No.
that. Oh, I've done that.
Why?
Because it's
Just
so,
why? Just why? Like
because it's just like freeing. I don't know,
okay. So you're on your hands and knees on a tile floor in your bathroom cleaning up like
n no.
long hairs and dust. How is that? How is that freeing? How is that? I, d- I don't see the appeal. It's not like they're saying I like to lie in my chaise lounge and read naked. That I would be like, oh, lovely, right? Clean your house naked, hauling a vacuum. I mean, what? I don't get
I
it.
mean, just doing
Doing
anything.
dishes with rubber gloves on. How exactly does this look? How does this play out?
I think the idea is just like doing whatever you normally do, but just doing it naked is
Well,
freeing.
all right. Well, there we go.
Yeah.
I
Like
love it.
I'm home alone currently, and I walked downstairs totally naked the other day and made coffee.
That sounds exactly like something you would do.
Why not? I was like, why? I didn't
But
feel like getting dressed yet. I was still a little hot from the shower. So I just, nobody's here. Who cares?
no, who cares? It's the how I think it's the household chores. Like if someone said dance naked, I'd be like, "Oh, it's kind of, feels kind of freeing and sexy." And doing household chores is another level. I
Well,
like
that's why it's a quirk,
this. I
right?
really like a person like that because women are so hard on themselves, and I just love someone who's that liberated. That's great.
I think it's great. Um, this woman says, I order water without ice with you
I get that
completely. Can't
totally.
stand ice and water.
Yep.
It's gross, first of all.
I think that's a little bit of an overstatement.
Ice
It's not
is not
gross,
always, it's
but
kind of gross from
I don't like,
restaurants. Who knows how long it's been sitting there? It's not always very fresh.
oh, you mean restaurants. Yeah, I was thinking
Yeah.
of my house. I don't love freezing cold drinks anyway, but I'm not into like super duper cold drinks. So that's kind of where I'm coming from. But yeah, okay. Okay. I guess it's gross to some people. I just think it's cold.
It's cold and sometimes potentially gross.
All right.
Not always. Depends on where you go, I suppose. I'm very particular about how straight and even my bed sheets are.
Okay.
Nice.
Get
I know
that.
somebody who irons their bed sheets.
Okay.
Could you do that? Would you do that?
Would I iron them? No, I don't need to. They look fine after they're out of the dryer. But I like the bed to be very neatly made. I love the way that looks and feels. But I'm not like totally extreme about it. She might be really extreme about it. I do like it very neat. I go from one side to the other and then back to the first side, and then it's perfectly straight.
Yes, to yeah, make sure everything is even and straight. I do that too.
Yeah.
Joni, midwife Joni says, I have the same cork collection. I wonder if it's a midwife thing.
That would be hilarious. If you're all secretly doing that and none of your friends ever knew, but you all found out you're all doing it,
That
that
would
would
be
be
great. That'd be
remarkable.
great.
Okay.
I bought my own dental tools so I can avoid the dentist. Okay.
No, what?
Sounds like a lot
Dental,
of work.
dental. How does she look in her own mouth and how does she know what to look for? You can't just
I
open your
don't
mouth
know.
and see a cavity, right?
I mean, maybe she's just talking about the little scrapers. I don't know.
Oh, dental cleaning. I guess. Okay. Very interesting. My gosh, people really have quirks.
I have specific laundry baskets for dirty laundry and clean laundry. I feel like that's not that uncommon. I do
Oh, I
not.
get it. So when the laundry is done, she won't put it back into the same laundry basket where the
Hmm.
dirty clothes were.
Right.
Interesting.
I save, this is a great one. I save all my egg cartons because I want to have chickens someday. She's going to have all the egg cartons she ever needs for the future chickens that she's going to have. She's manifesting her chicken life.
But everyone I know who
Maybe,
has chickens just puts them in a bowl anyway. They put them in bowls.
well, not if you want to give them to your neighbors.
That's true. I guess she better save up hundreds and hundreds and hundreds of egg cartons.
Maybe I'm destined to be a vineyard owner. Maybe that's why I'm saving all these corks.
And you'll find out from the Department of Health you're not allowed to reuse corks, especially ones that
Hmm.
are rolling around your kitchen floor.
Collecting dust for 20 years.
So
Can't
you're
use them?
gonna have to keep coming up with the rationale.
Okay.
But I'm gonna do everything to
Okay, fine.
snap you
Good
back into
point.
reality.
Fine. I have a giant jar of corks too. Does everyone not save them for some future art project? There we go.
You were not saving them for that reason.
I don't know why I was saving them, only because my brother once mentioned that corks were very, that the cork tree might be going extinct.
What are you going to do with your particular quirks and how are you going to help to save the world or
I
make
do
your own
not
life
know.
better? Well, maybe
I
it'll
do
pay
not
off
know.
one day.
It just happened, and now it's hard to throw them away. That's the thing. Once you start saving a particular thing, it feels like you're invested. So,
Oh
how do
yeah.
I start throwing corks away now?
Yeah, no, it would be you have to read The Life-Changing Magic of Tidying Up and
I have.
that book kind of puts a different brain into your head for a few weeks and you can throw anything out while you're reading that book. I need to reread it so I can go through that wave again of just not wanting anything.
Didn't work. It didn't
It's
work
so
with my
liberating.
cork collection.
Oh, it worked for me, but no, not with that. Yeah, you saved it last time. Okay, that's true. You'll save it again. What's next?
I take cold showers in the summer. Makes sense.
Not a quirk.
Not really. I most often have chocolate in my nightstand or top dresser drawer.
Really?
Nice.
I don't get
A
that.
little midnight snack.
I
Wake up
don't
in the
get
middle of the
that.
night, need a little chocolate snack.
Then you have to get up and brush your teeth. I don't get that. I don't get any eating in bed at all.
What? You
Well,
don't,
no,
what?
no, I don't get eating in bed at all. You get eating in bed? I don't get eating in bed unless you're
Yeah.
sick and you're drinking tea or something. No, because crumbs, because you have to brush your teeth after you eat. No, I don't get it at
You
all. What do
don't
you
like
eat in bed?
to
What?
have a bowl of ice cream in bed before you go to bed?
I love ice cream. In my life, I've never had ice cream in bed. I would never have ice cream in bed.
Oh, that's a regular thing for me.
In bed. Well, you
Yeah.
watch TV from bed though, don't you?
No, I don't have a TV in my bedroom.
Your phone. Don't you watch on your phone? No, not in a million years would I eat ice cream in bed. Not in a million years. I would have then a dirty bowl in my room. That would annoy me. I would have to get up and brush my teeth anyway. And just the feeling of lying down in bed, eating ice cream is,
Well, you're not lying down, you're sitting up
well,
in
like
bed.
leaning back in bed, eating ice cream. No, I would never
All
be
right.
able to
Well,
see myself the same way.
next time we go to Cliff House, Maine, we're getting ice cream and we're going back to the hotel and we're going to sit in bed and you're going to eat some ice cream in bed and see how lovely it is
Okay, I promise I'll have ice cream with you
in bed.
in bed long enough to take a photo for Instagram just to say that I did.
Okay. Fair enough.
That I will
It just,
slip out of the
just,
bed and proceed to eat my ice cream as I usually do.
it's just something you have to try in your life. Okay.
Yes.
All right. Just a couple more real fast. New dress equals Princess Day and lots of twirling. That's very cute. When she gets a new dress, she pretends she's a princess for the day.
I did that at your house the other day. I twirled wearing my new incredibly fluffy skirt from
Yes, you did.
Spain.
Yes, you did. I'm secretly a Disney adult. I don't know. I don't know what people say. It just brings me joy and heals my inner child.
Sweet.
Cute. I save glass kombucha bottles for water bottles. I always have backups. That's great.
Mm.
Glass jars are another thing that is really easy, really tempting to save. I have a really hard time throwing away the empty pickle jar.
You have a hard time throwing away a pickle jar?
Hmm.
I don't
Yes.
save any food containers. I don't get that at all. What do you do with it?
Well, I end up throwing them away because I don't really want to save them, but it's like painful.
Why? It's just a jar.
Just seems like you could use a jar. There's just something
Wow.
you're going to need a jar for.
I am not someone who reuses food containers.
Hmm. I
I
mean,
don't get that.
not necessarily for food. You might use it for your
No.
paintbrushes
For
to
your
clean your,
quirks.
or for your corks. You might
Place
need to
to
put
put
your
your
corks in
quirks.
them. Your Epsom salts for your bathtub. I don't know.
Okay.
All right. Moving
Well,
on.
that was fun.
That was fun. We want to know more, though. That's not enough. I want to know more of our community's quirks.
We do.
Shall we begin?
Well, you didn't ask me if I have a quirk.
Oh, of course. I need to know your quirk.
Yeah, well, I realized after we did the Instagram post, I wouldn't have been able to think of one, but then that very night I was like, "Oh my God, I have a really weird quirk." And it's not that exciting, but it's something that I do. I have this beautiful dresser in my bedroom. It's one of my favorite pieces of furniture, and I have no idea why. I don't close the drawers all the way. I close them like within a centimeter of closing all the way. And once in a while, I don't know why. I don't like to kind of, I guess, bang the wood or something. Like again, I don't know why, but once in a while I walk into my bedroom and I can tell that the drawers are not all closed. I'm like, what am I doing? This is it's such a lovely, beautiful piece of furniture and it doesn't look very good the way I'm living with it. So I'll walk over and I'll close them all. But that's a true definition of a quirk, I think.
Hmm. Yeah,
You
that
know,
is a true quirk.
it's not an OCD thing. It's not a neurosis. It's not a superstition. It's just a true quirk. It's like I just do it and I don't know why I do it, but I know that I do it.
Our brains just get programmed to
Yeah.
to do a certain thing.
Yeah. Yeah. So I'm gonna I'll,
That's a good one.
I'll keep, yeah, it is. I think it is a good one. And
Hmm.
I'll keep my eyes peeled for any other strange behavior that I have. I'm sure there's other things. So I absolutely can't wait to share them when I do. Okay.
Okay, well,
Let's get,
we're gonna keep sharing our quirks as we go. All right, on to the questions. Let's go.
all right.
Hi, Cynthia and Tricia. I'm currently pregnant with my second baby. My first baby was a beautiful home birth. She was bigger. She was 9'6", and her head and chest circumference were only about a centimeter different, with her chest being slightly bigger. I did do, for my glucose testing, 2 weeks of at-home testing with the fasting and after every meal, and my numbers were always perfect. I did those between 26 and 28 weeks, I believe. So I'm just wondering if there is concern that I should have about this pregnancy with gestational diabetes, and if you know if there's any research on late onset gestational diabetes that maybe I should be testing later in my pregnancy. Love you guys. Thank you for everything you do. Thank you.
I think she's overly concerned about the measurements of her baby, right? She's talking about, the
Head,
chest
chest
circumference,
circumference.
the head circumference. It's creating an unnecessary fear. She is testing her blood sugars. Has been no issue with her blood sugars. She did not have gestational diabetes the first time. Unlikely she's going to have it the second time. Is late onset gestational diabetes something that can occur, or undiagnosed gestational diabetes probably more often occurs? Yes, it does. It happens. And every time there's a big baby, everybody thinks, oh, there must have been gestational diabetes that went missed or whatever. But this is way over worrying. And gestational diabetes generally is early onset. That's why we test for it by 28 weeks, because it has to do with what's happening with the placenta and the beginning of pregnancy. So it's really unlikely. And I don't think she should alter her birth plans in any way. And I think she probably needs to do a little bit of work mentally to just sort of switch around her beliefs and trust that her baby size was great and her next baby size is going to be great.
Absolutely agree. I remember years ago joking, and not even joking, but like saying to my clients, mark my words, the day is going to come. People are talking about head and chest circumference. And here we are. There's no end to trying to measure and control birth. And this is the biggest journey we have as mothers. It's truly relinquishing. And just get yourselves back in that, as I always say, little house on the prairie mindset. Just imagine you simply miss your period for a few months. You realize you're pregnant, you're noticing bodily changes, and you just wait until the baby arrives. Just practice that mindset once in a while to restore yourself to what virtually every one of your ancestors did experience. And the question is, does it serve you to have that degree of trust? It does serve you. You're not going to neglect care. You're not going to stop all the things that you're doing. But maybe in between those appointments of checking on your baby, you're just going to relax sufficiently and let go of what's really ultimately out of everyone's hands. You have no choice but to trust.
I keep playing the devil's advocate today for whatever reason. It's just the mood I'm in. But
Now what?
I'm just saying, back in the day when we were not doing any type of prenatal screening, gestational diabetes really didn't occur much because we lived a very different lifestyle. Our diet was very different. We were active, we were in the fields. Little House on the Prairie days, gestational diabetes was not nearly the issue that it is today. It is a legitimate concern, but she doesn't have it. It is a
That's,
legitimate concern when it is real and when it is unregulated, when blood sugar is unregulated. It can cause complications in pregnancy and birth, but we are over worrying about it. We are over looking for it. The tests that we have to look for it are not very accurate. The screening tests are not very good. She's doing the best possible thing she could do, which is to regularly screen her own blood sugar. That is the best way to know what's
yeah.
happening in your body.
I don't
So
think that's contrary to what I said. I just said in between all your checking and all your usual doing, just let it go and just practice that level of trust just for a little bit. Just practice that trust. And in the meantime, she is checking everything. That's all she can do. And it's enough. We want to control and measure everything. And then for what? We can't change it anyway. You can't change the baby's head circumference anyway, the chest circumference anyway. We can't do anything.
she's
That's
doing
not the
everything
case.
right. And she's just got this fear imprinted in her brain. And I think the work is mostly in shifting that mental belief.
Yes, because she doesn't have it right now.
Right.
So exactly. All right.
Hi. I had a question. I don't really know if there's an answer to it, but I just thought that you all could weigh in. I recently gave birth to my third, and my mom was there, and she's a doctor, and she's now seen me give birth unmedicated, not in a hospital setting, and, you know, she's heard me talk about things very holistically for years, and there's a lot of things that we've been able to connect on, but one of them is, as I'm talking about my distrust in the medical group, you know, she feels a little defensive because she's immersed in it, and she's a phenomenal doctor. I definitely think she's one of the good ones, but she was saying, you know, a lot of these things that you're bringing up, these situations that you're bringing up, if a doctor hadn't had done due diligence and the patient had been harmed or the baby had been harmed, they're open to being sued. And she was pouring her heart out because the situation just isn't easy. And my mother, I would hate if she had to go through a situation like that, like if she did not do due diligence and then someone turned around and sued her and dragged her name through the mud. So again, I don't really know if there's a good answer. I know there's good doctors and bad ones and all in between, but yeah, it's hard when you can sue someone if they don't do everything they could to make sure you're okay, and then turn around and say, I wish you were more hands off with my birth. So I hear where she's coming from and just thought you could weigh in. Thanks.
I think the first point is all perspectives are correct. And you and your mother don't have to agree. You don't have to come to some consensus where you agree on every point. I totally understand your mother's bias toward doctors or her perspective. Everyone comes into everything with their own background and perspective. And I just think the general thing they're arguing about is very rhetorical. It's like this whole line of doctors doing everything they could do is exactly where the entire debate lies. So it's just rhetoric again. We're not talking about anything specific. So if the mother says something to her daughter like, well, I understand doctors doing everything they can do to save a baby. No rational person would disagree with that. I believe doctors should do everything they should do to save a baby as well. So it's a futile thing to argue about. Um, so I don't hear where the debate is, but surely the mother must understand, and there's data to support this, that unnecessary intervention, for example, routine interventions, for one easy example, does drive up the risk of maternal and infant mortality. We have decades worth of data to show that. So surely she and her mother actually do agree that doctors And where they might not agree is many would argue by default, the safest thing is for the doctor to do nothing. And the mother might be saying by default, the doctor should do something. And I would say that the data doesn't at all support that. But by default, the doctor should do nothing until there is a medical indication. And that's what I think any reasonable person on either side could agree on. But honestly, they don't have to agree. It's okay if they don't totally have the same perspective. That's all. That's all I think about it.
Well, this is the whole real struggle in healthcare, but particularly in maternity care, and the whole debate that we were having earlier this morning about coercion in obstetrics and fear of liability is a major player in decision making for OBs, and they admit it. There is research to show that some of their decisions are driven by liability and protecting themselves. So like you said, the question comes down to what is an unnecessary intervention? In their mind, a routine IV or antibiotics for every GBS positive woman is not a routine intervention. That is a strategy to protect the baby, doing everything they can to protect a baby or a mother.
But think about amniotomy. I mean, there's tremendous debate around that. It's hardly supported by evidence at all. And I wish what would happen in the court system. I wish, frankly, the court system understood this issue better, because instead of asking the doctor, did you do everything you could do? I wish they could say, like, let's say everything went south after an amniotomy. I wish there would be more questions around asking the doctor, what was the medical indication for what action you just took? What was your medical indication? But they completely forget that part. All roads lead to whether there's a medical indication for an intervention. And that's the
The,
part of the conversation that never seems to happen. It's just
the,
did you do something? Did you do everything you could? It doesn't mean
well,
it.
the flip side of that is if you did not do an amniotomy, they could say, and a baby, died in labor. Well, you didn't do something that could have sped up the labor. This
That
is why it's informed consent. This is why everything needs to come down to the risks and the benefit giving to the mother and the mother making a decision.
But see, first of all, it comes down to consent, as you said, and the whole thing should end there. If the mother said no, all right, well, here was an adverse outcome, and mother, do you take responsibility for the fact that you declined? But if everything went south and the doctor never did an amniotomy, there's no evidence there. There is no evidence for something that hasn't been done. They can't say, God forbid, if a baby dies and they say, well, you should have done an amniotomy, you should have done XYZ, 10 different interventions. You can't prove that that intervention actually would have saved a baby. So it's a very weak argument. But when you can prove that everything changed after an event took place, which is the intervention, that's a more risky place. So as a doctor, if I were a doctor, if I actually ever had to defend such a thing, I would be very concerned, obviously, about an adverse outcome, obviously about personal or professional liability. And I would just think, do I have a rationale for everything I do? Is there a justification for every risk I take?
The
That's where I think everyone should be paying attention. But that's hardly ever how the conversation goes, even between this mother and daughter.
The real problem lies in the lawyers, because I can assure you, this is why doctors don't get sued for doing a C-section. We know that there are increased risk to C-section. They will always come down on the provider who does less. You could have done something. You could have ruptured her membranes and sped up the labor. You could have taken her to a C-section 10 minutes earlier. It will always come down to them doing more, being supported by the lawyers. That's how it goes in court. It's not true. And again, informed consent has to be the only way. It is the only answer.
And it does come down to the attorneys, because in that case, the prosecuting attorney would have to ask the doctor about the risks of a C-section. Were you aware that these risks could occur if you performed a C-section? That's where more of the conversation needs to take place, because we do have the worst outcomes in the industrialized world. It's right in front of everyone's noses. And that's the key difference. And the more interventions we've had since the 80s, the worse the outcomes. C-sections, inductions, everything has gone up as far as interventions, and our outcomes have gone worse in accordance with that. But again, the mother and daughter don't need to agree. She's allowed to deeply respect her mother. I have no doubt her mother is an outstanding doctor, because this woman is informed and she can judge and tell that her mother is an outstanding doctor. But they don't have to agree on how to frame everything. They both have points. All these things are true and exist. And everyone just has to stop trying to agree with everyone on every point around this because they usually end up just talking about rhetoric anyway, which is exactly what happened.
And when
Do
you
everything you can do, doesn't mean anything.
if you have been to medical school, you are going to have a belief system around birth that is that birth is inherently dangerous and an accident waiting to happen. So it's going to be very hard to have a conversation. It is very hard. This is why it can be challenging for midwives and OBs to work together sometimes because one is coming from a perspective of believing that birth is natural, normal, and that mishaps are unusual and rare, and we should just let the physiology take its course. And medicine is coming from the perspective of if we don't do something, this is going to be a disaster.
But the bigger thing that doesn't get discussed enough is when ACOG was established, they made a decision. They opted for AML. They opted for active management of labor. They opted against expectant management. So I think sometimes they all lose sight of the fact that that was a choice that was made decades and decades ago, that their whole premise is they must get the baby out. They must do something to get the baby out. And it's only in that framework that they've all been trained. So I don't think that was the best choice. Obviously, we have the worst outcomes in the industrialized world to show for it, but they're losing perspective. They're losing the big picture perspective that they're still operating in that framework of management of labor. And within that framework, I'm sure her mother has a valid point, but it's the very framework that many of us would dispute. Let's go to the next one.
Hi, ladies. I am 8 months postpartum, and I had a question about sugar. I crave it all the time. I'm breastfeeding still. I've been exclusively breastfeeding for 8 months. It's really hard to not want sugar all the time, ice cream and cookies, and I know it's not good for me, and it's definitely making me gain weight, which I don't enjoy. And I'm wondering if you guys have any tips or tricks to stop craving sugar so much. I think it's partially like a mood boost too. Like I'm tired and I want sugar, or I'm sad and I want more sugar. So anything would be helpful. Thank you.
Do you remember that time years ago that we had a recording and I think we were in between recordings and I showed up to the Zoom call and you didn't know you left your camera on? And as soon as I sat down and your headphones weren't in, so you couldn't hear me trying to get your attention, and you were just sitting there with this perfect full-on profile looking out your window, eating a cookie slowly. And I'll never forgot you were just sitting there holding a cookie. It was just so sweet. One single cookie. And you were just looking out at the beautiful green yard and just slowly chewing this cookie. It was just such a memory I don't forget.
What kind of cookie was it?
I don't remember, but it was just seemed so unlike you because it's not, it was just such a sweet thing. You went and got one cookie and you were just treating yourself to like this one little cookie as you just sat, not multitasking. You were looking out the window and I was kind of, you couldn't hear me. So when you noticed me, you put your headphones in and said, "Oh, I'll never forget." You said, "Thank God that's all I was doing." Thank God that's all I was doing. Right. Because you couldn't hear me. I couldn't. It was so funny. Anyway, so
I think she answered her own question. At the end, she said maybe it's just because I need a mood boost or I need energy. It's true. Both of those things are probably true. She may be a little bit depleted postpartum. It's super normal to crave carbohydrates when you're breastfeeding. It requires a ton of calories. Your body needs carbs. The problem is when you choose sugar, you get an endless cycle of craving sugar. Sugar is not the answer. More energy through, complex carbohydrates is probably the answer, but she might have, she's 8 months postpartum. I can't remember. Did she say breastfeeding? She probably is a little depleted. She probably needs more protein. She probably needs to eat a more balanced combination of macronutrients every time she eats. Eating protein, fiber, and fat at every single meal, that balances your blood sugar. And if your blood sugar is steady throughout the day, you don't get those kind of cravings. You can have some sugar, but always have it after you have had protein, fiber, and fat. Never the first thing. If you eat sugar on an empty stomach, your blood sugar just spikes and then it crashes and then you need to replenish by doing it again. And then you are just in this vicious cycle. she can break the cycle.
Right. You don't want sugar to hit the bloodstream quickly. And an easy way to deal with the sweet tooth part of it is it might not be what she wants to do, but she's still having that craving, is switch over to fruit. I mean, just eat a container of strawberries or raspberries or something instead. It is going to satisfy the craving. Or make herbal tea and put honey in it. It might not be as delicious as whatever you're currently eating or whatever snack you got yourself hooked on lately that you're really enjoying. But if you drink a cup of herbal tea with honey in it, it is going to satisfy the sweet part. You just have to be willing to do it. You have to be willing to eat or drink something that isn't as tasty and that you're as excited about as the dessert.
I think just in general, it's really about thinking of the bigger picture of your blood sugar management over time. And you don't have to deprive yourself of sugar, but you need to start eating in a way that helps you balance your blood sugar. And she needs to make sure that she's just eating enough in general, because if she is not eating enough as an 8-month postpartum breastfeeding mother, her body is going to crave sugar because that's fast fuel. And then that, just what you said about spiking your insulin, and then that tells your body to store the calories as fat, and then it's just a bad cycle to be in.
Well, that's a wrap for the regular part of the episode. Now we're moving into our next 3 questions, and I have no idea what they're about. I don't remember at all.
I wrote all the questions out.
Okay, so you'll just have to read the episode description. We'll type them out in there. And you can get these by being a subscriber on any level, tier 1, 2, or 3 on Patreon. We always post these episodes in full, ad-free, extended. And if you're on Apple subscriptions, which is not even $30 a year, you get every single episode ad-free and with every single extended episode included. And you don't have to do anything once you do that. Once you sign up for that, they automatically go into your feed. You don't have to do anything to go find them or anything like that. So we hope you're with us because we do double the work and we want everyone to benefit from it by getting the full episodes.
And I don't remember what these questions are, but I know they're good.
Oh, and if not, then it is time for quickies.
Okay, it is quickie time.
This
Quickies are just fun. I like them. They're fun, easy, playful, not too serious. Okay. How accurate is fundal height? Should the weeks exactly match the centimeters? Isn't this really fascinating to you that the fundal height matches the weeks, the number of centimeters, that the weeks pregnant you are matches in centimeters?
Mind-blowing.
Like, why?
But what's funny is just how arbitrary it is because humans came up with centimeters to begin with. So this is not an inherent law in nature because nature didn't come up with centimeters. So that's partly why it's interesting. And it isn't the average is exactly week to centimeter, a 1-to-1 ratio. But isn't it plus or minus 1 to 2 centimeters on each side? That's still under the range of normal.
I would say 3, plus or minus
Good.
3.
Good.
Yeah, it's just interesting that when a baby reaches the belly button, it's about 20 weeks. And
I
then
find
it goes
the
up.
purple line more crazy and wild and fascinating.
Really?
That's all nature. And who the heck knows why that's happening and how that can measure, how that can tell how far a woman is dilated is wild. But centimeters, yeah, it's just an incredible coincidence since humans came up with centimeters. It's very cool. And I wish we would measure more women by fundal height. That's the way it should be. Absolutely.
Well, that's the way it was always done.
I know.
And really, it's just about looking about growth. So it does not have to match exactly.
Right.
Around 20 weeks, your baby should be, the top of your fundus should be right around your belly button. And then it should go up about 1 centimeter each week thereafter until 40 weeks. However, around 36 weeks, if your baby drops down low in your pelvis, it could drop 3 centimeters. You're going to be measuring a little bit off. Yeah. Anyway, variation is normal. You have providers who, measure differently. Women's torso length plays into it. It varies. Okay. Is it really necessary to go to weekly appointments at the end of pregnancy?
Some would say no.
I mean, some women don't do prenatal care at all. We do know that on a large scale, that does tend to lead to worse birth outcomes on a large scale, on a population level. But I would say if there's any time to go to prenatal visits, it is the last few weeks of pregnancy. I'd rather you skip early on and go more later because that's when
risk goes up.
More concerns can come up.
Yeah.
Do you have any remedies for postpartum hemorrhoids? They are actually worse than giving birth.
Witch hazel?
Yeah, the witch hazel tux pads are helpful. And really, it's about making sure that you have soft bowel movements, that you're not straining, because if you're continuing to strain, those hemorrhoids aren't going to heal. If you have very soft and no straining, then they can heal. But the witch hazel tucks do work well.
Okay.
Is it normal for an exclusively breastfed baby to start feeding for only 5 minutes on a side? It can be if they're older, for sure. Yeah, especially between the 4 and 6 month age when they're really distracted. Then they just have to feed more frequently, but they might feed for 1 or 2 minutes at a time and then come back 5 minutes later and do it again. Is spotting normal in postpartum when you have not gotten your period back? Yes, I would say that could be normal. I don't know how far postpartum she is. I mean,
Right.
if she's 5 weeks postpartum, yeah. Um, I think she's not though. I think she's probably past her initial bleeding and she hasn't gotten her period back and she's probably spotting and that is probably hormonal. And she's probably going to get her period soon. Can breastfeeding amenorrhea stop then start? Yes. It's not really that breastfeeding amenorrhea is stopping and starting. It's just that your cycles are irregular when they return after breastfeeding. So you might get one and then skip a month or two and then get another one. But you're not protected at that point. Like you can't count on lactational amenorrhea to prevent pregnancy. Can LEEP scar tissue prevent or stop cervical dilation? Ooh, which episode is that with Nathan Riley? Yes, it's true that any type of procedure to the cervix can create scar tissue, and that can definitely create stalls or slowed dilation.
That was episode 299.
Perfect.
We'll never
Okay,
forget that one.
listen to 299. Does defrosted breast milk that tastes like vomit mean it's high lipase milk?
Ew.
I wouldn't describe
Ew.
it as
Ew.
vomit tasting.
Ew. That's such a horrible thought. Say something else quick. It's so gross.
I mean, probably, yes, that's her perception of how it tastes. Typically, high lipase milk is described as soapy or metallic.
Okay.
So maybe the metallic and the vomiting thing kind of go together. I don't know.
No idea.
Does laboring down cause fistulas? Well, it could, I suppose. I mean, any birth can cause a fistula, but if you're very medicated and not feeling anything, and you're laying in bed and you're on Pitocin and your uterus is being forced to contract harder than it might otherwise do or be, and you don't notice because you have an epidural, then yeah, that could definitely put more strain um, on the posterior vaginal wall or even the anterior and cause a fistula. Okay, one more and then we're on to the personal. Do you have a fix for restless legs in pregnancy? I'm already taking magnesium and iron. Please don't say giving birth. Restless legs can be very irritating in late pregnancy. Iron and magnesium are usually the go-to remedies for that, but also hydration is a really important one. So if you're not doing electrolytes, you should do that. And good sleep hygiene. It's very hard to sleep well in late pregnancy. I get that, but the more it, because it's also like a nervous system thing. So the more that this is happening and the more you're anticipating it happening, the more it's going to happen. So, and if you're sleep deprived, it's going to happen more. If you're tired, exhausted, depleted, deficient, dehydrated, it's all going to happen more. So I would say a good sleep schedule and movement throughout the day. Just, making sure that you're walking and moving and not being stagnant, which is hard in late pregnancy. Okay, that's it. Personal quickies are, do either of you paint your nails? Well, I obviously do.
You get manicures a lot. We
I
weren't
like
just talking about this. You just had a manicure, and on the very next day, one of your nails completely chipped. So I get
more than one.
pedicures. Yeah, I get pedicures, but I don't get manicures because they never last more than a day. So sometimes I'll just do my own with a clear. But my toes are painted right now.
Yeah, so you have to, a regular manicure is worthless because it lasts like a day or two, but you can get longer lasting polish. I like Dazzle Dry and it can last 7 to 10 days with no chipping.
Really?
Yes. So yeah,
Hmm.
there's no way I'm going for a manicure every week. It's too much maintenance, but I can handle it every 2 weeks. All
That
right.
wasn't that personal. That wasn't that hard.
There's one more.
Uh-oh. I spoke too soon.
Would you tell anyone besides your partner about your pregnancy before 12 weeks?
Sure. Yeah. Um, I don't know about like work, but the reason is that we conceived upon my first ovulation when my son was 15 months old. Completely unexpected, immediately pregnant again. Last thing we ever expect, we had Vanessa 4 years later, and that was intentional. So we never expected to have children close together. And we were shocked and happy and thought, oh my gosh. And then I miscarried almost immediately, very, very like within that week. And then I found myself telling a lot of people close to me because I was miscarrying. And I thought, this is interesting. I was not telling people because the whole argument is like, what if you miscarry? But when I experienced a miscarriage, just a few days later, I did tell people I was pregnant and now I've miscarried because I just wanted to be able to have a little bit of that understanding and support from the friends close to me and the family close to me. That's all. So I would say tell anyone who you would tell that tell anyone who you could trust with your miscarriage business if, God forbid, it resulted in a miscarriage. I feel like that's the level of trust of the people you can tell under any circumstance. Why not? Just happily tell those people because no matter what, you'll have them in your inner circle. So might as well share the joy early on with them. Those are my feelings.
Yeah, I wouldn't put it on social media, but I would definitely tell the people I'm close to. Sisters, mother, close friends.
All right. That wasn't that hard either. No. Ooh, they're a little easy on us this month. Sometimes it's really tough. Sometimes it's really tough. And it's hard to think of things on the spot once in a while, but those were easy to answer. All right. Well, thank you everyone for the excellent questions.
Yes, and thank you guys. If you love the show, please don't forget to give us a 5-star review. The reviews are very helpful in the podcast reaching new audiences. So if you love us, please leave a review. If you don't, please just let us know. If you don't love this episode.
If you don't love us, no, don't let us know. If you don't love us, just go on with your life. Don't spend
find a different podcast.
There's no reason for an official breakup. There's not just you find your people.
Just leave.
We'll find ours. See you next time.
All right, thanks guys
for being here.